The World Health Organization is to ramp up efforts to prevent Ebola spreading beyond the 3 countries most affected by the deadly virus. 15 African countries are being prioritized, top WHO official Isabel Nuttall told a Geneva News conference. They will receive more help in areas including prevention and protection. U.S. public health officials are being questioned at a congressional hearing on perceived failings in how the U.S. has dealt with cases. Spike. The transmission of the Ebola virus remains intense in Liberia, Sierra Leone and Guinea, the WHO's Dr. Nuttall said. There was a spike in the Guinean capital, Conakry, said Dr. Nuttall, and intense transmission in Freetown, the capital of Sierra Leone. In the Liberian capital, Monrovia, she spoke of significant underreporting and problems with data gathering, making it hard to reach firm conclusions. But there was a drop in the number of cases in Lofa district. Farmers in Sierra Leone have deserted their land during the Ebola outbreak. Overall, cases were doubling every 4 weeks, said Dr. Nuttall, the WHO's Director of Global Capacities Alerts and Response, and the death toll was expected to go above 4,500 this week. Countries in the region must be prepared, she said, listing Benin, Burkina Faso, Cameroon, Central African Republic, Democratic Republic of Congo, Gambia, Ghana, Mauritania, Nigeria, South Sudan, and Togo. She highlighted 4 nations directly bordering the worst affected area: Ivory Coast, Guinea-Bissau, Mali and Senegal. We will ramp up our support to the countries. We will work with them on a plan, but a plan needs to be changed into action. Actions will include rapid response teams, engaging at community level, training in infection prevention and protection, having laboratories in place. Earlier, the WHO said the introduction of Ebola in the US and elsewhere was a matter of concern, but a major outbreak was unlikely given the strength of health systems in the West. In another development, the European Union is to examine whether exit screening at West African airports is effective. EU health ministers also agreed to try to coordinate measures taken at EU airports. Some countries, such as the UK, have introduced screening. Texas nurse in the United States. Questions are being asked about why 2 nurses who treated an Ebola patient from Africa have themselves become infected. Thomas Eric Duncan died at the Texas Health Presbyterian Hospital after arriving in the U.S. from Liberia. Nurses Nina Pham and Amber Vincent both contracted Ebola after treating him. Both wore face shields, hazardous materials suits and protective footwear as they drew blood and dealt with Mr. Duncan's body fluids, and it remains unclear how they were infected. Officials say Amber Vincent was allowed to take a commercial flight after treating him, and officials have been contacting the 132 people who flew with her. Daniel Varga, the chief clinical officer for the company that runs the Texas hospital, told the congressional hearing, "We are deeply sorry for the mistakes made in the way Mr. Duncan's case was handled." Opening the hearing, Chairman of the House Subcommittee on Oversight and Investigations Tim Murphy accused the Centers for Disease Control of changing course on measures that would have strengthened quarantining. He also cast doubt on airport screening, saying those with a fever could avoid it. But in his opening statement, Centers for Disease Control Director Tom Frieden said everything was being done to prevent transmission of Ebola. There are no shortcuts. Everyone has to do their part. We are there to support. We are there with world-class expertise to protect Americans.